Department. At this time, I'll turn the meeting over to Mecklenburg County Public Health Director, Dr. Raynard Washington. Dr. Washington.
Thanks a lot, Bill. I'm looking to see if I don't see Dr. Passaretti yet, but I'll go ahead and get, oh, there she is. All right, perfect. We can go ahead and get started. Thank you all for joining us this afternoon, and let me also extend my thanks to Dr. Katie Passaretti, Vice President and Chief Epi at Atrium Health, as well as Joy Smith, our county's Communicable Disease Director, for joining me this afternoon. I will note our partners at Novant Health were not able to join us today due to a scheduling conflict. Today's media availability is an opportunity for us to provide an update to you all and the community on both the ongoing COVID-19 pandemic, as well as the outbreak of monkeypox here locally and across the state. So I'll start my remarks with COVID-19, then talk a bit about monkeypox, and then turn it over to Dr. Passaretti for any updates from the healthcare system, and then we'll take questions. We are seeing notable increases in COVID-19 activity across the county. Similar to the state and national trends, we are seeing increases in our wastewater monitoring sites across the county, as well as our reported cases, which of course we know is an undercount of true cases of transmission, true levels of transmission in the community. But either way, all of those indicators are increasing. Our hospitalizations are also slowly increasing, and we are starting to see more patients who are requiring intensive care. We do remain in the medium CDC COVID community level. That was updated last week and will be updated again this coming week. I do anticipate at some point we may transition to the high level if the current trajectories continue. The CDC has reported that nationally 75% of the counties in the country are either in medium or high right now. And so these trends are happening locally, but also across the country. Much of these increase is being driven by increasing prevalence of the BA.5 Omicron subvariant, which now represents more than half of our cases locally based on our own sequencing data, and is very quickly outpacing BA.4 and other subvariants. As has already been noted, this subvariant is certainly more transmissible and does appear to be more immune evasive compared to prior subvariants, which of course is of great concern. As noted in our release last week, we are concerned and we want to make sure that folks in our community are aware of these increasing trends and everyone take precautions and take advantage of the resources that we do have available to reduce the impact of COVID on our community. I know you all have heard me say it a number of times, but I'll reiterate it here. It's important that folks get vaccinated and stay boosted. Consider wearing a high quality mask when you're in indoor public settings, particularly those who are incredibly crowded or poorly ventilated. And this is especially true for individuals who are more vulnerable to COVID infection or severe disease. Those that are medically vulnerable, have underlying health conditions, or are older. But with current level of transmission, everybody should weigh their risk as they go out in public and keep masks handy, obviously continue to practice hygiene, and really, really important for folks to stay home if they're sick. If you're feeling any kind of cold-like symptoms, allergy-like symptoms, or COVID-like symptoms, please stay home if you're sick, don't go around others, and take a COVID test, which of course we have available widely in the county. If you've had COVID recently, I also want to remind folks in the community, if you exit isolation at 5 days because your symptoms have resolved, it's also still really important that people continue to wear a mask for the following 5 days, up to 10 days, while they're going into public settings. Shifting now to monkeypox. The monkeypox outbreak in the US continues to escalate, and that's happening here locally as well. As of this morning, there have been 12 confirmed cases among Mecklenburg County residents. By our count, that's more than half of the cases that have been confirmed to date in North Carolina. So far, the epidemiology of the outbreak here is very similar to the broader US outbreak. That includes that all of our residents that have been confirmed so far are males. Most are between the ages of 25 and 44, and 2/3 of them are African Americans. Most of the males also report sexual contact with other males. And our communicable disease team has been successful at tracing these cases to other confirmed cases in other jurisdictions, mostly out of state to date. At this time, there are no known severe cases, and all the cases that we've been in contact with are isolating safely at home, and their close contacts have been notified as provided and vaccinated as appropriate. It's really important to note that while this current outbreak is disproportionately impacting the MSM community, that this is not a sexually transmitted disease, meaning that sexual contact is not required for transmission. While I fully expect our case counts will continue to rise here locally, there are a number of steps that we're taking and we're asking our community members to take alongside us to help us work towards containing this outbreak. First and most importantly, for everyone, but particularly men who have sex with men, we all should be taking precautions to ensure that we're not exposed or not exposing others. And that certainly includes limiting close contact, physical contact, specifically intimate and sexual contact with people that you don't know or who may have monkeypox like symptoms, who may have been diagnosed with monkeypox. And certainly you should ask about monkeypox like symptoms before engaging in close contact. Avoid close skin to skin contact with people who have a rash that looks like monkeypox or could be potentially monkeypox. And if you have any symptoms, including a rash that's not explained, or your lymph nodes are swollen, or you have flu like symptoms, please seek medical attention quickly. And if you do have a rash, it is also best to cover that rash until you're able to go see your provider. Testing availability is expanding in the county. The CDC has worked with our commercial labs to be able to bring on capacity, both through LabCorp and Quest and others. We know that additional labs, both academic and commercial labs, will be coming online soon. And many of our community providers are starting to be able to offer testing, but of course, it's also available at the health department clinics. And you can contact our hotline if you need some assistance or navigating or finding a location to get tested. Next, if you're diagnosed with monkeypox, it's really important that you answer the health department's call when we call. And when you do talk to our communicable disease nurses, please provide as much detail as possible about your potential exposures in the community. This process is so important, just as you all remember with COVID, this contact tracing process is really important. We're at a critical phase in the monkeypox outbreak where we've really got to work towards containment. And so having that information helps us. So I ask those in our community who may be affected to just be honest with our nurses, be transparent, and remember that the process is highly confidential and the information is protected. Uh, but we really got to do this process in order to be able to identify individuals who are potentially exposed in the community and notify them and get them vaccinated as quickly as possible. I also encourage folks, if you're engaging in sexual contact with anonymous partners, to attempt to capture a method of communication or some means of identifying that person if in fact you have monkeypox or even an STI of some other sort. And while I'm speaking about sexual activity, it's also important that we continue to emphasize safe sex practices, as we're also seeing some of our cases co-infected with other STIs like syphilis, and HIV. As many of you probably know, this weekend there will be a Black Pride celebration here in Charlotte, as well as Charlotte Pride is coming up in August. The Public Health Department is working very closely with both of those coordinating agencies to ensure that we're doing everything possible, both on the outreach awareness and making sure resources, testing is available for the community. We also need our media partners' help to also get the word out, because it's not just the activities that happen officially at these events, but of course, other activities. We want to make sure all of our residents are exercising caution as they also celebrate, given what's happening during the current outbreak. Lastly, I want to talk about vaccine supply shortly. Our supply remains critically low. To date, here in Mecklenburg County, we have received 667 doses of vaccine for our region. Of that, we have actually transferred 80 of those doses to community providers as required by the North Carolina Department of Health and Human Services. It's also important to note we've got 667 doses, but this is a 2-dose series for the vaccine, and so that's actually only enough to serve just over 330 residents. As of this morning, all of our appointments are full, and we have more than 500 individuals on our wait list right now, with that list growing by as much as 100 every day. And so we encourage everyone who may be eligible, and I'll go over the eligibility criteria in just a second here, but to add your name to the wait list online or call our hotline staff and they can help you navigate how to get your name on the wait list. And we are calling folks as we either have cancellations or opening of appointments to fill those spots with folks who are eligible. People who are eligible right now, of course, are individuals who have been in close contact in the past 14 days with someone who's diagnosed with monkeypox. And of course, we are prioritizing those individuals with known close contacts to a confirmed case, and individuals who are know that they have a sexual partner that's been diagnosed with monkeypox. Also, those individuals that may have been exposed. And then lastly, any individual who falls in the category of a man who has sex with men or transgender individuals who've had multiple or anonymous sex partners in the last 14 days are also eligible to add their name to the wait list at this time. I and our team continue to advocate for more vaccine allocation to Mecklenburg County, particularly given the greater impact the outbreak is having here. And we look forward to receiving more vaccine later this week from the state. And we've heard at least that the CDC will also be making more allocations available over the next several weeks as we move into additional phases of the vaccine rollout. As a reminder, we can be reached at the health department at 980-314-9400. Choose option 4 for monkeypox related questions. So with that, those are my updates, and I'll turn it now to Dr. Passaretti to see if she has anything she'd like to highlight from the healthcare system perspective, and then we'll open the floor and all three of us will be available for questions.
Yeah, I think you summarized perfectly. I just reiterate from the healthcare system side what we're seeing. You know, we never really came down from the prior BA.2.12.1 variant. And so the new cases are layered up on top of what we had seen previously. And we're seeing that in the community, but also translate into some increases in hospitalization where we had been stable before. So continuing to watch that very closely on the COVID front. And would just kind of reiterate, you know, there's a lot of questions circling about timing of vaccines, boosters, whether to get up to date now. And, you know, just like Dr. Washington, continue to encourage everyone to be up to date on their COVID vaccines to provide the maximal protection as we head into what we anticipate to be a kind of rocky next couple of months in fall respiratory viral season. On the monkeypox side of things, as we are, just like we're educating the community, we're educating our physicians on how this outbreak looks a bit different than what we classically think of monkeypox. And with that, getting that word out, making sure people are asking questions when they present to their doctor with an unusual rash continues to be super important. But we are seeing an increase in cases diagnosed within our healthcare system that contribute to the pool that Dr. Washington mentioned. So, you know, those preventive messages are just super important to get out there to protect our community from further spread. And we're super excited about starting to have at least some vaccines available to try to get our community protected.
Great. Thanks, Dr. Passaretti. Joy, anything that we missed?
No, I think you did great jobs. Thank you.
All right. Floor is open for questions.
Thank you, Dr. Washington. First question today goes to Chloe Leshner, WCNC.
Hi, thanks so much for doing this. Dr. Washington, you mentioned that we could be shifting into the high level soon. Do you have any context to provide kind of what needs to happen between now and then, how quickly that could be happening?
Great question, Chloe. I don't actually know specifically if that will occur. You know, right now there are a number of criteria that go into factoring in what level we're in as a community, and we're getting very close to the levels in terms of our weekly or daily hospital admissions, as well as our case rate is increasing overall. And so we're watching very closely to see what happens. But I do think it's important to continue to proactively message to the community that we've got tools available to help us not get to that point. And so before we get there, if we can continue to get folks engaged and know that COVID is spreading, it's here. And while we had hoped that we'd have a quieter period in the summer, we're not. And so as Dr. Passaretti mentioned, this is leading into the fall respiratory viral season, and this may be a continuous sort of elevated activity. So it's really important to get the message out to everyone to continue to take steps to be precautious and protect themselves.
Next question, Claire Donnelly, WFAE.
Thanks so much for doing this. How is monkeypox testing supply in Mecklenburg County and in North Carolina? Where did the tests come from? And how much of an undercount is that 12 cases?
So So at this time, we don't have any evidence of community level transmission yet in Mecklenburg County. As I mentioned earlier, our CD team has been able to trace our cases to other cases, most of which are out of jurisdiction, most of which are out of state. And so the testing supply is currently, I would say, growing significantly across the county. Both of our healthcare systems are making testing available in their ambulatory practices or certain designated sites. Of course, both of our clinics at the health department are able to test individuals as needed and with no wait time for appointments, et cetera. So I think right now testing is widely available, but we need folks to, if they're experiencing symptoms or have a rash, and have been engaging in close physical contact with others, I think it's important for those folks to come in and get tested and at least give us a call and go through the screening process to see if they would qualify for testing. If they have symptoms, specifically a rash, then it's important for them to get back to us. And so certainly there may be some unknown cases in the community that we're not aware of. That's always a potential to do that. I don't know that I have any evidence at this point to give you a magnitude of how much may be unknown at this point.
Next question, Caroline Hicks, WBTV.
Thank you. We're hearing a lot of people getting reinfected with COVID. Can you explain maybe why this new subvariant is more infectious than previous? And should people be worried about attending some of these big events that we have going on in our city, concerts, sporting events, and things like that in terms of COVID?
Yeah, I think certainly the concern around reinfection is related to the BA.5 having these more or heightened immune evasive properties, meaning that it's able to get around people's natural immunity because they've had prior infections, or even the protection that's offered because of their vaccines. And so we are expecting to see and are hearing more about people that are being reinfected and even shorter reinfection windows, which typically the window is somewhere between 3 to 4 months, but we're hearing about people getting reinfected more quickly. So that's certainly concerning. I think, again, with the increased community impact and the increased transmission that's happening in the county, as indicated by all of our indicators, including wastewater, we know that there's a high concentration of COVID in the community right now. And so I think everyone should be exercising caution. So if you're going to public events, especially that are crowded, like concerts or conferences, it is important for people to consider wearing a mask and taking additional precautions when you're at those kinds of settings. And of course, monitoring for symptoms and testing as needed before and after to ensure you're not becoming infectious or spreading it to others.
Next up is Blake Douglas, Charlotte Observer.
Hi, Dr. Washington. Thanks for doing this today. And you had earlier mentioned that the stats that are available right now for monkeypox infection are disproportionately representing folks that have same-sex partners. Is that something that the county health department is kind of cognizant of when it is communicating this information to the public? Because we have heard concerns from folks in the LGBTQ plus community who have those concerns that this could be the type of stigma that is connected to the HIV/AIDS pandemic that had gone on 80s, 90s, even into today. Folks are worried about that. Is that something that, when communicating this, the health department is concerned with as well?
Thanks for the question, Blake. Certainly, there's certainly concern with stigma. So I think there is a delicate balance here that we must continue to maintain. It is really important for us to communicate to the public what's occurring and what's happening in the community from two perspectives. One is to make sure that people are aware of who's at risk, who's being mostly impacted by something. And so I think it's really important that we emphasize and are clear with the community about who's most at risk, who's mostly impacted, because that is what justifies and supports our decisions, for example, to make vaccines available to highest risk groups. And so that communication about the epidemiology is important to communicate. We have to also at the same time be sensitive to the stigma that could be potentially associated with identifying or focusing in on one group of individuals. However, it doesn't relinquish us of our responsibility to also communicate about risk in the community. The second side of this too is that because it's not a sexually transmitted disease and it can be spread without having sexual contact, we also don't want to offer people who are not in the MSM community a false sense of security about potentially their risk and what their risk may be, because of course you can also transmit monkeypox again without having sexual contact. And so we want to make sure we keep a balanced communication, balanced messaging to the community about again the risk here and who's at risk and who's at greatest risk, but also be transparent with the community so that folks know, hey, I could potentially, if you identify in one of the groups that I just described, I could potentially be at risk and I may need to take additional precautions. And it would be irresponsible not to do that and make that information available to the public.
Thank you so much.
Up next is Brett Jensen, WBT Radio.
This might be for Dr. Passaretti or obviously Dr. Washington, because you're both infectious disease experts. In terms of the normal course of these type of viruses, I mean, I've heard, and I'm sure a lot of the people have heard, non-experts, that they generally start out strong, very infectious, and do damage to the body, like the initial COVID-19. And then as they progress, new variants, they get more contagious, but less impactful to the human body. Is that accurate? Because I've been told that a lot, but I don't know. And B, are we seeing that now?
So, Brett, I'm going to pass you to Dr. Passaretti, but just to clarify, are you talking about monkeypox or COVID?
I'm sorry, I'm talking about COVID, the Omicron variant, and how
Gotcha.
it's more contagious. And I think even Dr. Priest from Novant yesterday said there's even debate now, what's the most contagious virus in the world, measles or this new Omicron variant?
Sure. So, Dr. Passaretti, you want to take a stab at that first?
Sure. I think there's a lot of stuff that plays into what we're seeing translate as far as increase in cases. And how severe the illness is. So, we know that people that have been vaccinated continue to be very protected against more severe disease, but they can still get mild infections. And similar with prior infection, oftentimes that can reduce the severity of future infection. So I think it's hard without looking at the broader picture to know that the virus itself is more transmissible, more severe, without taking into account that we're in a very different place than we were at the very beginning of the pandemic due to protection built up, hopefully by vaccines, but in addition, prior infection. So, I think it's a much more nuanced answer to how transmissible each variant is compared to the other, because every point in time is different from the one prior as far as our community level risk.
Next question, going back to Chloe Leshner. Do you have a follow-up?
Thanks so much. This could probably be for either Dr. Washington or Dr. Passaretti, but since the rule with school boards having to vote each month on whether to have a mask mandate is going away, is masking in school something we should be considering ahead of next school year? And can school boards make that decision if there's not like a county mandate or county push for it?
So certainly we are continuing our discussions with all of our local K through 12 partners, and including our planning discussions with CMS for next school year. Obviously, the conditions in the community will impact many of the critical decisions about what happens in the school district next year. But to suffice to say, the school board does have the ability to impose restrictions that protect the health of students as needed, as they deem necessary. And certainly, I think at this point, communities across the country are continuing to assess what's happening in their school systems, and certainly would encourage all school districts to create an environment where masks are welcomed, and individual students have an option to choose to wear them, but also that they're available and are welcomed in the school setting.
Next up is Caroline Hicks, WBTV, with a follow-up.
Thank you. Dr. Passaretti, I know you mentioned hospitalizations starting to tick up. Curious if you can comment on like the severity of these hospitalizations and whether we're seeing more severe illness with this variant.
Yeah, so, we are definitely seeing an increase in infections, increased spread in our community, and with that, that's translating into an increase in overall hospitalizations. The good news part of the story, as far as this particular variant goes, is as of right now, we're not seeing huge increases in number of patients requiring ICU stay due to COVID. So most of the hospitalizations right now are still kind of severe enough to be hospitalized, but not ending up we're not seeing big increases on our side, a number of patients on ventilators in the ICU. Obviously, that can change over time, but right now we're staying pretty stable with those numbers.
Next up is Blake Douglas with a follow-up question.
Hi, and this could go to either or. Add a quick follow-up regarding the what do we know about how transmissible monkeypox is at the moment, and coming off of, or still being in the midst of, rather, the COVID-19 pandemic, and kind of the fatigue folks have shown, the not wanting to mask and things like that we've seen in different communities across the country. Are you a little bit concerned that folks will see see the messaging about this and be like, oh, this is another scare, another way they're trying to force us to wear masks, etc.?
Hey, do you want to take the first part of that, or Joy? Either one of you guys. The first part.
Yeah. Joy, did you want to, or you want me to?
Yeah, I was just going to say, with the cases that we have identified, we've been able to tell that those cases were sexually transmitted. At the same time, in our talks with the people that we're following up on and with the state, we're continuing to remind people that this can be transmitted outside of that setting via household contacts. There is a low risk for respiratory transmission, and just trying to have those conversations to reduce kind of the fear and hopefully help with some of the mistrust.
And can I just piggyback just for 2 seconds? It's not so monkeypox is not as easily transmitted as COVID is by respiratory. So it's close personal contact. So not the direct, as Dr. Washington mentioned early on, it's not necessarily that it's a true sexually transmitted diseases, but the sexual contact, which brings, people into close contact for longer periods of time, is how monkeypox is spread. But the transmissibility, as Joy kind of referenced, is lower than we see with COVID and whatnot. So the number of people infected from a single person is overall lower, but obviously, we need to make sure we're putting community measures of prevention into perspective and kind of making people aware.
And I think just to touch just very briefly on the last part of your question there, certainly I think we know for sure that there are a lot of folks who are fatigued with COVID and pandemic response altogether in the community. But I think part of what is important and what's helpful and what you all are able to help us communicate to the public is that there are other health issues that are threats to our health outside of COVID, and it's important for us to take those health issues very seriously. And to not discount the validity of them because it's new and unknown. There are a lot of emerging infections in the world and in the globe that are common. So we've got to make sure that people recall and remember that the work that we do in public health and healthcare is essential to keeping people alive and keeping people thriving in life every day. And so these messages are important. And while monkeypox may not be as infectious as COVID, it may not be transmitted the same ways. It's important as infections emerge in the community, whether it be hepatitis or monkeypox or HIV or anything, that the community heeds the messages and precautions very closely, because again, the goal here is to keep people safe.
Thank you.
If I just may add a point of clarity, so the people that we have identified cases among, while they were sexual partners, there's still no thought that, or we can't confirm that this is sexually transmitted via vaginal or seminal fluid. It's just that those people happen to be participating in that act. So I did want to make sure to clarify that.
Thank you.
Next up is Claire Donnelly with a follow-up.
Yeah, Dr. Washington, you mentioned testing capacity is growing. How many tests for monkeypox can North Carolina run per day, per week? I don't know what the best metric there is. And then how exactly does that testing process work? It's the lesions are being swabbed, I guess, but then, how many labs can test those monkeypox swabs?
Sure. So give me 30. Actually, so right now in the state, there are a number of laboratories that are prepared to do testing. That includes the state laboratory, LabCorp, Quest, Aegis Sciences, Sonic, and Mayo Clinical Labs. And so the access points for those testing providers are actually frontline healthcare providers. So that includes, as I mentioned earlier, the ambulatory sites of the healthcare systems, designated sites, and other community providers. And of course, the health department is available for testing as well. And so I encourage people, you shouldn't have to spend a lot of time looking for testing. You can just come into the health department. We do have capacity and are prepared to do testing as needed for people who meet the testing criteria. The CDC is working to increase capacity across the country to be able to handle roughly 70,000 tests per week. But again, that's their target or their goal, but that we've not reached that level yet. I don't have an exact count of our own capacity here across the laboratories, but I can confirm that our turnaround times are holding steady at roughly 24 to 36 hours. So right now, testing capacity is not a challenge for us. I think the big issue is just making sure that individuals who are symptomatic and need to be tested are getting tested. And obviously, as we are identifying close contacts, getting those folks under monitoring and tested as appropriate.
Just one quick follow-up, like what is the potential bottleneck there? Is it like, the testing media or the swabs, like early COVID? I know we had, problems accessing that stuff.
Certainly. So I don't think there are a lot of, at least immediate concerns. Globally speaking, there are universal tools universal supplies that's used for the collection. I think part of the big challenge right now, as Dr. Passaretti mentioned earlier, is making sure that our provider community outside of the health department and those designated sites that I described earlier are prepared to identify individuals who have monkeypox-like clinical profiles and to be able to obviously do the swabbing themselves at those locations and not have to refer the patient to another provider or to us for testing. And so our provider education activities, which have started, several weeks, 2 months ago, actually, are continuing. And so there are more, I know AHEC is hosting an education session for providers coming up later this week. We're planning on additional opportunities. I know our health systems are working internally to make sure that their providers are up to speed, both on identification of the virus, but also making sure that there's processes in place to get folks quickly into testing. So if anything was a concern on the testing front right now, it's really sort of just processes and making sure providers are prepared to do the testing. But I think our laboratory capacity, at least for where we are right now in the outbreak, this outbreak has grown pretty quickly, especially in some other jurisdictions. And so right now we're okay with testing capacity, but I know that could become a challenge if it were to get too large. What we're trying to do though is, contain to the point where we don't actually need that much testing demand in the community, which we need you guys' help to get the messages out.
Thank you.
Sure.
We have a follow-up question from Brett Jensen.
Hey guys, I don't mean this to be a pointed question, but whatever happened to herd immunity between all the infections and the vaccinations? And I mean, I know, Gibby talked about that ad nauseum, as well as national health directors. Whatever happened to herd immunity?
So Brett, I think, and I'll start, and Dr. Perez, feel free to jump in. I think, we don't really think about herd immunity in the construct of viruses like COVID-19 at this point, where it's constantly mutating, and the mutations give it the ability to reinfect individuals, because you really can't achieve herd immunity because the virus itself is taking on different forms and shapes that allows people to not be protected. And so if people are not protected because they're vulnerable to infection, because the virus is now able to evade their immunity, then you seeking or trying to achieve herd immunity is not really feasible. You think about, for example, like the flu, which also replicates and mutates just as much not as much as COVID, but it does mutate quite a bit. As we have new strains and new variants of the flu, then individuals who were previously infected then become susceptible again because it has the ability to evade that immune protection that was offered those individuals from either a prior infection or vaccination. So that's sort of where we are with that. Dr. Passaretti, anything you want to add to that, or Joy?
Yeah, I would just, COVID is here to stay. And I think that's been the message for quite some time now, as we've seen kind of different variants, and it is acting just like other respiratory viruses do. The goal now, and has been, preventing people from getting severely ill, dying from COVID. So the best way, again, to do that is staying up to date with vaccines and, taking the protective measures to protect the highest risk individuals.
All right, we have a follow-up question from Chloe Leshner.
Going off of that, what about reaching the endemic phase? Is that something that's still a possibility, or as it keeps mutating, is it just something we'll always have around?
So, Chloe, just going off what Dr. Passaretti just said, COVID is here for now and to stay for the foreseeable future. Being endemic is not some light switch that we just kind of flip in public health and say, oh, now it's endemic, and we've gone from the pandemic phase to being endemic. It essentially is a state of being. And at this point, we don't have we're not on a pathway towards eradication or containment of COVID-19 as a virus. And so I think in theory, we're in the endemic phase. As you might imagine, it's here, it's circulating, and it's mutating. And so its mutations are causing it to have a longer trajectory in terms of how long it's around. And so I think it's here, and we are going to have to contend with it and continue to stay very closely monitoring the situation, monitoring what's happening with it as it's mutating. But as Dr. Passaretti said, we really have got to focus on reducing its morbidity and mortality. And the way we do that is make sure people are vaccinated. The most vulnerable to severe illness and hospitalization and death are protected by vaccines and potentially other resources like masking. And then everybody taking personal accountability and adhering to the things I described earlier about vaccines, but also making sure that they are staying home if they're sick and not getting other folks sick, and taking those protective measures that we all know are successful at keeping us from spreading COVID and other viruses.
Caroline Hicks, you're next.
With COVID being a little more top of mind for people again with this variant, are you guys seeing more people seeking out the vaccine, either for the first time or for boosters?
Caroline, that's a good question. There has not been any notable increases or decreases in vaccine uptake over the last 2-week period. But we certainly, we've seen a little bit of an increase with the younger group being able to get vaccinated, but it hasn't been, the majority of our vaccines now are still boosters. But certainly we have data available that can sort of quantify those differences for you over time, but it hasn't been anything notable that we felt bubbled up to needing to highlight today.
Okay, floor is open for follow-up questions. Any further questions today? Last call for questions. All right, thank you all very much. We'd also like to thank our American Sign Language interpreter, Richard Hafner, for today's news conference.
Thanks, Bill. Thanks, everyone.